Channel 32. 32.5. Be sure to watch.
What a company, man.
That's right. I get $1 for everybody I break in.
Can I just give you $1 to read?
That'll work. That'll work. You're not up today?
I'm up second.
Oh.
We'll do questions.
So, enunciate.
Pardon?
It's long.
Yeah.
Well, good afternoon, everyone. Welcome back to our daily briefing. Today marks our 60th daily update in a row. To the delight of many reporters who have been working these long days with us, beginning this weekend, we will no longer hold weekend in-person briefings, but instead we'll release daily medical statistics on Saturday and on Sunday. And then we will be back on Monday, and we'll continue with weekday briefings as usual. And now I'd like to call on Dr. Ezike for our daily medical update.
Thank you, sir. Thank you, Governor, and good afternoon, everyone. I know there are many questions about the data, such as where it comes from and how the numbers are adjusted. Let me start by trying to explain our efforts and provide you with the most current explanations. We have lots of data that we're always trying to get to you in real time. What this means is that as soon as the data is reported to us, again, we are not going out to collect the data is reported to the Illinois Department of Public Health. As soon as we get it, we're trying to share it with the public. However, by doing this, it means that the data potentially can change as new information is updated. Let me share with you a common example. If IDPH receives a lab report that has an incorrect address for an individual, when we give that information to the local health department to promptly investigate the case, they might find that, no, this in fact is not a resident of my county. This is actually a different county. This now means that the number of cases for those two counties, their report totals will fluctuate. One will go up and one will go down. So ordinarily, with all the data that IDPH handles, our data managers and our data stewards usually take time to really clean the data, remove the inconsistencies, delete duplicates, etc. But during this pandemic, as we're trying to share the information so quickly, we're not able to do all of that work. So as we move forward with Restore Illinois, we will provide you with this timely data that will be meaningful, but we share with you those caveats. To that end, we're also, of course, giving you the hospital utilization data, we're giving you hospital availability data, and we're giving you positivity rates on our COVID testing. Information on hospital admissions for COVID-like illness is reported to IDPH directly from the hospitals through an automated surveillance system. We call this syndromic surveillance. The data, again, will lag by a few days, but by doing so, we're helping to capture at least 90% of the data for that time period. Our goal is to be able to both give you complete data and data quickly and trying to mesh those two goals. IDPH values the diligence of all those staff and all the personnel who supply the state with this much needed data. And every single day we have staff and personnel from hospitals, from testing laboratories, from local health departments who are supplying this critical information. This information is vital to shaping our understanding of exactly where we are in this pandemic, where we're headed, and what we might need to do. I thank Governor Pritzker for listening to the data and using it to make the tough decisions he has had to make in keeping all of Illinois safe. And now let me turn to our latest statistics. To date, we have run a total of 379,043 tests for COVID-19, with 17,783 tests being resulted in the last 24 hours. Since yesterday, of those 17,000+ tests resulted, 2,641 tests were positive. That's a 15% positivity rate. And that brings our total number of positive cases to 70,873. Most sadly, we report that we have exceeded 3,000 deaths related to COVID for the state of Illinois, with the additional 138 lives reported as lost over the last 24 hours. We now have a total of 3,111 fatalities. Regarding inpatient admissions related to COVID, 4,862 individuals as of midnight were in the hospital with COVID, and of those, 1,253 patients were in the ICU. Of those ICU patients, 766 patients were on ventilators. We are still fighting this invisible enemy, and we must continue to take measures to reduce its spread. Please, let's honor our elderly mothers and our grandmothers this Mother's Day by keeping them safe. To do that, please stay at home. Please wear your face coverings. Please wash your hands frequently. Thank you. And with that, I will translate into Spanish. Buenas tardes. Sé que hay muchas preguntas sobre los datos, como de a dónde viene y por qué los números a veces cambian. Permítanme comenzar diciendo que en nuestro esfuerzo por ser transparentes y dar los datos más actuales, estamos informando datos en tiempo real. Sepan que cuando nos dan los datos, los compartiremos con el público. Sin embargo, al hacer esto, los datos cambiarán a medida que se informa nueva información. Permíteme compartir contigo un ejemplo. IDPH recibió un informe de laboratorio que tiene una dirección incorrecta para una persona. Cuando el Departamento de Salud local investigó el caso, encontraron que la persona vivía en un condado completamente diferente. Esto significaba que el número de casos para los dos condados va a cambiar. Eliminamos un caso de un condado y agregamos un caso al condado correcto. Por lo general, tenemos tiempo para revisar los datos y hacer lo que llamamos limpiar los datos. Esto implica identificar cualquier duplicado o información incorrecta antes de compartirlo. Pero durante esta pandemia, sabemos que compartir información rápidamente es importante. A medida que avanzamos con Restore Illinois, queremos dar información que sea significativa. La información sobre la gente con enfermedades de COVID es reportada directamente a IDPH por los hospitales. Usamos un sistema de vigilancia automatizado que llamamos vigilancia sindrómica. Estos datos mostrarán un retraso de un par de días, pero al hacerlo esperamos poder capturar casi 90% de los datos para ese periodo. Eso no quiere decir que los números todavía no cambiarán, pero nuestro objetivo es poder dar la información más completa posible. IDPH valora la diligencia de todos que están dando datos muy necesarios todos los días, incluyendo las personas en los hospitales, en los laboratorios de pruebas y los departamentos de salud locales. Gracias a ustedes. Esta información es vital para dar forma a nuestra comprensión de dónde estamos, dónde nos dirigimos y qué debemos hacer. Le doy gracias al gobernador por escuchar a los datos y hacer las decisiones difíciles durante esta pandemia. Acabo hoy con los números. Hasta la fecha hemos realizado un total de 379,043 pruebas para COVID-19, con 17,783 realizadas en las últimas 24 horas. Desde ayer se han reportado 2,641 casos nuevos para un total de 70,873 casos totales. Desafortunadamente, ahora hemos superado 3,000 muertes. Desde ayer se ha reportado 138 muertes adicionales por un total de 3,111 vidas perdidas. A partir de la medianoche se informó que 4,862 personas en Illinois estaban en el hospital con COVID-19 y de ellos 1,253 pacientes estaban en la unidad de cuidados intensivos y 766 pacientes en ventiladores. Todavía estamos luchando contra este enemigo invisible y debemos seguir tomando medidas para reducir la transmisión. Muchísimas gracias. And with that, I will turn it over to Governor Pritzker.
Thank you very much, Dr. Ezike. Today, I want to update you on our work to get unemployment benefits to the unprecedented number of Illinoisans who have lost their jobs to the spread of COVID-19. The devastation this pandemic has wreaked upon our economy, the economy of the United States and that of the world, is mind-boggling. The swiftness and immediacy of its economic impact has never been seen before. Businesses, large and small, have shuttered. Families have had their savings wiped out. Workers who have worked every day of their adult lives have found themselves on unemployment for the first time ever. In just over a month between the beginning of March and April 4th, the Illinois Department of Employment Security saw more initial claims filed than in all 12 months of 2019 combined. Then, in the following month, between April 4th and May 2nd, that number had nearly doubled. As of today, IDES has now processed more than 1 million initial unemployment claims just since March 1st. That's over 1 million claims in just the first 9 weeks of this crisis. Compare that to the first 9 weeks of the Great Recession of 2008, when there were 180,000 claims in Illinois. This historic number of claims has also led to historic levels of benefits being paid out. In the first 4 months of 2020, Illinois has paid out over $2 billion in claims. That's $500 million more than what was paid out in all 12 months of 2019. The pain and devastation for people who lost their jobs is heartbreaking. Beyond the thousands who died, and tens of thousands who've been sick, and hundreds of thousands who've lost friends and loved ones to COVID-19, the financial toll on the people of Illinois has been breathtaking, and it's unprecedented. IDES is an often overlooked agency, which has been fundamentally defunded over many years. It has 500 fewer employees now than it did during the Great Recession a decade ago. Its computer systems, like those of many other states, was built in the aftermath of the Great Recession with the idea that nothing could ever be worse than the Great Recession. Yet this current crisis has seen national unemployment claims surpass that era several times over. IDES's systems were unfit to handle the surge, causing tens of thousands of Illinoisans to wait at a moment when families are hurting at a scale the world hasn't seen before in our lifetimes. IDES employees have built their lives around doing the public service of helping people through these tough times. And they've demonstrated their deep commitment repeatedly during this crisis. They have been working every day to expand our systems and capability to meet the increased need as quickly as possible. In many ways, they've been forced to build a new airplane while flying it. Over the last 2 months, IDES has used every avenue available to build up capacity. Employees have worked thousands of overtime hours to process the avalanche of claims. The agency brought on new employees, brought back retired employees, increased daily call center hours, updated the phone systems, grew the number of phone lines, overhauled the web platform, implemented an alphabetized filing schedule, and brought on outside partners, including IBM, Pitney Bowes, Deloitte, Google AI, Quantify, and Carahsoft. And that's all in a matter of weeks. For those reaching out over the phone, our new call center is now up and running. There will be 100 new agents by Monday, and we will continue to scale it up with 100 additional agents taking calls. For those filing online, while there is still more work to be done, IDES computer systems have improved measurably. Load times for web pages now average less than 1 second. The IDES chat bot that Google AI helped build answered over 3.2 million inquiries in its first 2 weeks online alone. And this past week, we launched a voice agent to further assist those trying to file claims. As a result of these improvements, IDES is now paying unemployment benefits in a timely manner to 99.9% of clean claims. And the majority of these claimants, approximately 75%, receive their first payments within 2 weeks of filing. In order to expedite getting income to the unemployed as fast as possible, by executive order, I waived the traditional delay of a week before the collection of benefits, allowing unemployment claimants to receive 2 weeks of benefits instead of just 1 in their first payment. Illinois was also one of the first states to implement the additional $600 per week in federally funded benefits from March 29th through July 25th through the Federal CARES Act, offering our residents and their families extra support to help pay bills and put food on the table through this pandemic. IDES was also quick to implement the 13 additional weeks of CARES Act-funded unemployment benefits for those who run through their first 26 weeks of eligibility. And on Monday, as promised, IDES is prepared to begin processing claims for 1099 workers, including independent contractors and sole proprietors, self-employed individuals, and many others who don't qualify for traditional unemployment. Under the new Pandemic Unemployment Assistance, or PUA, program, claimants can receive up to 39 weeks of benefits backdated to the first week of unemployment. The new public website is prepared to process more than 140,000 PUA claims per hour, and we will be using capacity at our new call center to support PUA claimants starting Monday. I want to review the process, though, for applying for PUA benefits, because unemployed individuals who qualify can begin the filing process even now, instead of waiting until Monday, and I encourage you to do so. That's because the federal government requires that workers who believe they may be eligible for the PUA program must first apply for regular unemployment insurance, likely getting denied, before applying for benefits under PUA. That denial for regular unemployment benefits is a mandatory first step in determining PUA eligibility according to the federal government. But there's no need to wait until Monday to take that first step. There's another reason getting this step done early is so beneficial. In filing for regular unemployment, claimants also select how they want to receive their benefits, direct deposit or a debit card onto which their benefits will be loaded. For those who choose the debit card, which can take up to 1 to 2 weeks to arrive in the mail, that card can be mailed out after you finish filing for regular unemployment, even if you're denied. If you're a worker who qualifies for PUA, your card could already be on the way to you before you even open the PUA application portal on Monday. This is an enormously difficult time for many, many Illinoisans. The economic pain of this pandemic is enormous for Americans in every state, no matter their religion, the case count in that state, or the political leanings. As we look toward reopening businesses and jobs with hope and optimism, it's my promise to every Illinoisan that I won't rest until we get our residents the support they need to get through this battle. Thank you, and I'd be happy to take any questions from members of the media. I think we're going to start online and then come into the room.
All right.
Jim Haggerty at Rock River Times. Governor, some business owners are wondering who is going to be making the final decision on when regions may move through the 5-phase plan. Is it county board chairpersons, mayors, teams of leaders, or your office?
Actually, it's a healthcare determination. As you saw, each of the criterion for meeting the regional reopening is a healthcare measure. So it will be done by the Illinois Department of Public Health.
Dave Dahl at WTAX. Governor, whenever you are asked about enforcing executive orders, you slough it off to the locals. You make it sound as if your orders are merely suggestions. What gives?
Well, first of all, that is how laws are enforced across the state of Illinois, by local law enforcement. We have state police, but there are 2,000 state police, and there are many, many tens of thousands of police officers all across the state that work for local and county governments, as well as sheriffs. And so it is true that laws are enforced at the local level. We expect that they will be enforced. That's the responsibility of law enforcement officers, of state's attorneys, and others at the local level.
This is from Chris Carter at WAND. Governor, we hear of large businesses seeing outbreaks of COVID and reporting that information in numerous counties. In Champaign and Sangamon counties, the health departments will release the names of businesses, stores where confirmed cases are at, but the Macon County Health Department refuses to provide that information, saying it is IDPH guidelines. Do you as governor feel in any interest of public safety businesses where outbreaks should be reported?
I think that it is important for the people who work at those locations and people who patronize those locations to know if there's been an outbreak. So I think it's a responsibility of the local public health department to make that known.
He had one follow-up for Dr. Ezike. What is IDPH's official stance on businesses such as manufacturing companies providing information on positive cases to employees and the public?
So there is a mandated reporting to IDPH regarding outbreaks. And so I think people are reporting that information to us. We are capturing the information. All of the information you have regarding outbreaks is what has been reported, obviously, from the locals. Regarding putting out information regarding manufacturing, I don't know if we have specific guidance related to that. I think people are using their discretion to do what they think is appropriate in their locales.
Mike Militich, Quincy Media. A growing number of police and state's attorneys say they will not enforce your order even if complaints are made. Have you considered utilizing state police and state licensing agencies to hold people accountable?
Yes, and I've talked about that before.
Cisco at WBBM News Radio. The NFL is announcing its 2020 schedule this evening. If Chicago is not at Phase 5, will even a reduced number of fans be allowed to attend games at Soldier Field?
Well, again, we want to make sure that everybody's safe. So all across the country, if the nation isn't in a state where we can have tens of thousands of people together in a stadium, then I don't think you're going to see football opening up to having fans in the stands. However, you may know that many of the leagues and teams, and I have spoken with many of them, are considering opening their seasons or continuing their seasons without fans in the stands so that people can enjoy the sports online on TV.
Dave McKinney at WBEZ. A valet to President Trump has COVID-19. Given the president's reluctance to wear a mask, do you believe he should quarantine for 14 days? And can you outline when you and your staff wear masks at the office? What's the status of your staffer who had COVID?
Yeah, I think as a leader, you should set a good example for people. You should follow the rules. Look, you can get tested after you've been exposed to somebody to determine whether you have COVID-19, and I would hope that the President of the United States has been tested after finding out that he's been exposed to somebody with COVID-19. But I think that wearing face coverings in public and in offices where you can't keep social distance and where it may be required by the IDPH in its guidance is appropriate. And we do wear face coverings in the office. It's something that we began doing not that long ago, but some number of maybe 2 weeks ago, where when we have meetings or anything else, everybody is encouraged to and asked to wear a face covering.
Shia at Politico, how does the general election fit into the new phase-in plan?
Well, I think you've heard me say this many, many times. we need to have mail balloting for everybody in the state of Illinois so that we can make it much, much easier for people to vote who otherwise may not be able to leave their homes. It's especially true for those most vulnerable populations. So it's very important that we pass a law, the legislature, when they get together, to make sure that we have the ability to do that in this state. Obviously, there will be in-person voting as well. And so, you know, how we implement that will be important, but I think that'll be, again, with a lot of guidance from the Illinois Department of Public Health.
Ben Cox at WLDS. Governor, was everyone given the phase 3 green light on May 1st, or will historical data be used for some of the regions to push forward towards reopening? Is historical data back to March 20th being used at all?
Not for the purpose of the Restore Illinois plan.
Greg Hines at Cranes, would you respond to complaints from the convention industry that putting them in phase 5 will just force them to meet in another state?
First, I would tell you that, once again, just like we were talking about large gatherings for sporting events, this is all dependent upon where we are at the time. If we have a very effective treatment or we have a vaccine available, then I can't wait to welcome people back to large gatherings, to conventions and so on. I'm the first person that wants to bring business to the state of Illinois and put people back to work. So I'm looking at that. I mean, in terms of when we will get to stage 5, I don't know, and, you know, we'll be evaluating that as we go. I think, you know, again, we've talked about the treatments that may become available before a vaccine, and I think we'll all be watching very closely.
Molly Parker at the Southern Illinoisan, you explained that your restore regions are in part about hospital availability. Are you also looking at available beds in neighboring states that people are most likely to utilize, like in Southern Illinois that includes the Cape, Paducah, St. Louis, Evansville?
I'd like to ask Dr. Ezike to answer the question, if I may.
No, that's a very good question and a very astute point, that we have many different communities, both in the Quad City area, in East St. Louis, other areas that border other places. We, of course, know that, as well as the fact that there are people who could travel into another state, there are also individuals from the other state that could come into our state. So you potentially could say that that's a wash in terms of trying to figure out what extra amount of beds you could either add or take away based on the added population of neighboring states versus our people going to that. So they were not outside of our Illinois. All the lines were drawn within the state borders, and we did not add beds from neighboring states.
This is from Andy Weber in Peoria, who asks, Running Central, a clothing and running store in Peoria, has filed a lawsuit against the governor for the extended stay-at-home order and is seeking an exemption. How do you respond?
Once again, everybody has a right to take a case to court to file a lawsuit, but the fact is that the goal here is to keep everybody healthy and safe in every community, even in that community, and I certainly would encourage the people who might patronize who might be patrons of that store not to do so, and the local officials to enforce the executive order that's in place. And again, the goal here is for us to keep everybody safe and healthy and to reopen the economy in phases, so the opportunity for that store to open may arise just in 3 weeks or so.
AJ with WICS, when will the state start reporting COVID-19 recovery numbers?
So I have been trying to do that on a regular basis, once weekly, here from the podium, and we will work to get that on the website. That's not a problem, to give our percentages.
This is from Lisa at NPR. A new study from Harvard shows Illinois among the 41 states that fall short of benchmarks for adequate testing. Is it realistic that Illinois will be able to reach the suggested target of 64,000 tests a day? What specific steps are you taking to get there?
I'm sorry, what was the website that's
It was
citing
a
this?
Harvard study?
Yeah. Every state in the country, let's be clear, is trying to ramp up testing. We're doing it better than most, indeed. We're, number 2 among the top 10 most populous states in the nation, even now, and we continue to ramp up our testing. So all I can say is that with a worldwide shortage of all of the supplies that has existed for so many weeks, and with the challenge of not having any coordination of testing from the federal government, or ability to gather supplies, only recently some swabs from the federal government, which I'm grateful for. But yeah, I mean, we're all trying to get to a sense of adequacy. I don't think 64,000 is adequate for the state of Illinois. I think we're going to need many more tests than that. We want people to be
Good afternoon, and thanks everyone for joining us again today. We are pleased to how well the reopening has gone this week, and we remain optimistic about the future. Earlier today, myself and First Lady Teresa had the opportunity to be out to a Hy-Vee store here in Jefferson City, to Orscheln's, just to kind of see how things were going with the general public, how people were conducting themselves with social distancing, and how the businesses themselves were operating and what standards they were putting in place. And I'm proud to say that the majority of people that we've seen out there today was using common sense. They were doing what they were being asked to do. The businesses have really stepped up to protect their employees and protect the customers. And as you see, people are starting to go back and engage in economy. So was glad to see that today, glad to be out to kind of show the support of the businesses here and make sure people are knowing it's okay. I think one of the other things, after seeing some of the businesses open and how innovative they've become about selling their products or making sure that the consumers feel safe, whether that's curbside service, whether that's delivering all products, whether you're at the Orscheln store, the Hy-Vee, restaurants, that you see a different form of lifestyle starting to move forward in our state. And I assume we'll see that in the next several weeks till we get the economy back up and going at a conservative pace. We're making sure the public is safe. As of today, there has been 9,341 positive cases of COVID-19 and 418 deaths. Again, I want to point out the number of positive cases is a grand total since March the 7th. The vast majority of these people are currently recovering or have already recovered. Our hospitals do have the availability, the capacity, and are prepared if a surge were to occur. Since Missouri's peak hospitalization in early April, the total number of hospitalized COVID-19 cases is down by approximately 17%. Although we aren't yet seeing a steep decline in St. Louis, we are beginning to see a noticeable flattening. In addition, our testing volume has increased over the past several days. Over 100,000 people have been tested in Missouri, and the percent positive of these tests continues to decline. Out of those 100,000, roughly 90% of the people tested negative. Medical data also shows a significant decline in individuals with flu and COVID-19 symptoms. This is all very encouraging as we continue moving forward with our recovery plan. We remain confident that we have met our 4 pillars, and we will continue to monitor this data each and every day. For Missouri to feel safe going forward, we will need to develop a COVID-19 vaccine. We are proud that the Pfizer Research and Development Facility in Chesterfield, Missouri, is one of 3 Pfizer locations in the United States that has selected as an initial manufacturing center for the vaccine production. This week, Pfizer and its partner, BioNTech, started human trials for the COVID-19 vaccine program. Today, we are very proud and very pleased to have Christine Smith here with us, head of the Chesterfield R&D facility, to give us more details about that. Christine?
Good afternoon, and thank you, Governor Parson, for the invitation to be here today. And thank you for the kind introduction. I just want to add that I am St. Louis born and raised. I went to school in Mizzou, and I currently reside in St. Louis County in the city of Des Peres. On behalf of Pfizer and our entire team working at our Chesterfield, Missouri facility, it is a true honor to be here today. It is our sincere belief that to beat this pandemic, it will take science and creativity along with the determined will of passionate researchers. I share with both pride and optimism that Pfizer, along with our partner, BioNTech, have started human trials for the BNT162 vaccine program to evaluate vaccine candidates for the prevention of the COVID-19 infection. This trial is part of a global development program. U.S. trials began this week, and the dosing of the first cohort in Germany was completed last week. The technology that Pfizer and BioNTech are developing is known as mRNA vaccine or messenger RNA vaccine. The messenger RNA vaccine is composed of subunits linked together in a specific order that conveys genetic information to make protein antigens that are specific for a pathogen, and in this case, the virus that causes COVID-19. In order to put those individual subunits together in the messenger RNA vaccine in the correct order or sequence, a template is required. This template is made biosynthetically and is required for each and every manufacturing run. And the Chesterfield, Missouri Pfizer site will be manufacturing this template. So to support our clinical manufacturing of the vaccine, the template starts in St. Louis, Missouri, in Chesterfield facility. The messenger RNA will be made in Andover, Massachusetts, and formulation and vialing will occur in Kalamazoo, Michigan. Now, once the messenger RNA of the vaccine is inside the body's cells, the cells use those instructions to produce protein antigens, which are recognized by the immune system of the vaccinated individual, which in turn generates an immune response to the antigen. We are currently investigating whether the vaccine candidates we are studying will be safe and effective in creating this immune response against COVID-19. Our Chesterfield R&D site, in addition to manufacturing the template, is a part of a team currently developing processes and methods that will be required to produce large volumes of the vaccine if our vaccine candidate is shown to be safe and effective. At the same time, Pfizer is actively scaling up our manufacturing capacity and distribution infrastructure to be ready to make the vaccine available as quickly as possible if it's successful in clinical trials and approved by regulatory agencies. We continue to work closely with regulatory agencies to develop, test, and manufacture this potential messenger RNA-based vaccine at an unprecedented pace. We are leveraging decades of scientific expertise in pioneering vaccine discovery and development to respond to this global health crisis. In a short order of time, We worked closely with regulatory authorities and accelerated what typically would have taken months into weeks, and weeks into a matter of days in order to rapidly and safely enter the clinic. And every step of the way, honoring our quality culture that is so important to deliver safe and effective medicines and vaccines. By doing many of these steps in parallel, rather than sequentially, we have the potential, subject to technical success and regulatory approvals, to supply millions of vaccine doses by the end of 2020 and rapidly scale up to produce hundreds of millions of doses in 2021. All Missourians should be proud of the fact that so much of the process development work on this vaccine is happening here in Missouri, at Pfizer's state-of-the-art R&D site in Chesterfield. We are more than 500 strong in Chesterfield, and we will continue to work on the vaccine, of which we are giving the utmost urgency, as well as other life-saving medicines in the Pfizer portfolio. At the same time, we work in new ways so that we can safely increase our odds of having a successful vaccine. Together with our partner BioNTech, we are rapidly advancing multiple COVID-19 vaccine candidates into human clinical testing. BioNTech and Pfizer are testing 4 vaccine candidates, each representing a unique combination of the messenger RNA format and target protein antigens. Each of those 4 candidates is potentially being tested at 3 different doses and 2 different age populations in a single clinical study. The design of this study allows us to move urgently while preserving highest quality and safety standards. Our work is very challenging, but we have an incredibly talented and experienced group of scientists, engineers, biochemists at Pfizer and at Chesterfield, whose mission and purpose is to develop innovative new biologic medicines and vaccines. Of course, our work is being done within a larger healthcare ecosystem. Many companies, pharma companies, and biotechnology companies, as well as academic institutions, are working around the clock to discover, manufacture, and test vaccines and therapeutics to respond to this health crisis. And we all need to have hope for many successes. In closing, I am super proud to be a scientist working in the pharmaceutical industry and working at Pfizer and doing it right here in my home state, Missouri. And we believe now more than ever, #Science will win. So I'd like to thank Governor Parson for this opportunity and thank you all for your time today.
Thank you, Christine. Thank you for Pfizer being here in Missouri. And as I listened to your story a little bit about a homegrown Missourian, I guess to say, I could tell how proud you was. But as the governor of the state of Missouri, how proud I would be if we were the ones that developed the vaccine here and be able to present that to the nation from right here in Missouri. So I thank you. I thank you for everybody that's working there and trying to help our country right now and help the people of our state. Dr. Williams is also here today. He'll be here for questions. Further, we'll get them both back up here that you can ask questions with. In conclusion today, let me just say this. Today will be our last briefing of this week. There will be no briefing tomorrow. We will be in Southwest Missouri tomorrow doing some one-on-one interviews, and we'll resume briefings again on Monday. So with that, I'd like to leave you with some positive words as we move into the weekend. Today is National Day of Prayer, and Teresa and I would like to invite all Missourians to join us in prayer. When President Ronald Reagan spoke during the 1981 National Day of Prayer, he said, "The strength that prayer gives us should never be forgotten." Now, more than ever, Americans need our prayers. Today, we pray that our state and our nation will continue to be blessed and protected. We pray for our doctors, our nurses, our law enforcement officers, and all of our workers on the front lines of this crisis. We pray for those who have lost their loved ones during COVID-19. We pray for all Missourians, for their health and for their safety. Also, Sunday is Mother's Day, and I would like to personally thank all of the mothers in Missouri for their dedication, their support, and the love of their families. Thank you all for the sacrifices you have made during these challenging times. Missouri will always have the support of our prayers. God bless you, God bless the great state of Missouri, and God bless the United States of America. Kelly, let's open it up for questions. Let's see, you want to go Christine and then Dr. Williams?
Questions for Christine Smith first, right now.
Hi, so there were some initial estimates thinking that a vaccine would take 12 to 18 months to develop. You talked about it a little bit, but what has happened to help significantly reduce that time that's been estimated?
Oh, a couple things. As I mentioned before, we're doing a lot in parallel. We have an open communication and collaboration with the regulatory authorities. And when we look at how to supply some of the critical reagents and materials to get the manufacturing started, we have a very open and good communication with the suppliers. So those are just a couple of things. And dedicated scientists really working hard.
Can you kind of explain how working on this virus and developing the vaccine is different than even another virus like hepatitis that's, chronic in the population?
So I can speak from a manufacturing position. This vaccine is different because it's a novel technology, and we're using messenger RNA to actually deliver that message for the body to produce the antigens that the immune system will react to. So it's quite different.
All right.
Thank you. Thank you.
Dr. Williams? Any questions for Dr. Williams? Kristen?
Hello, Dr. Williams.
Hey, Chris.
You mentioned that the state could get some testing supplies either today or tomorrow. Have they arrived today?
I was just with Bill Whitmore, and he didn't mention it, but my promise to you is the day they come in, we'll let you know. And again, I just want to join the governor in thanking Christine. It is so exciting. Messenger RNA is an incredibly innovative strategy that will get us quicker, and I think all Missourians, we've had great luck with the Chiefs and the Blues, and we're pulling for Pfizer and her team. It's just so exciting that's happening here in Missouri.
Hi, Dr. Williams. There are some states that are working to conduct statewide testing with large groups of people, and I know that we are doing the community sampling and things like that. So just wanted to check in and see, are we working, or is the state working on doing widespread, 100,000 people kind of community sampling testing?
Not at this point. We're talking about doing another prevalent study, a prevalent study. We did a snapshot study last week. We're talking about doing a prevalent study in about a month, which would be more randomized, and you could extrapolate from that. But I'll tell you the other thing is, when we talk about having the 60,000 tests, what we really mean by that is to make those commercially available to our hospitals, to our doctors, that they can use them. And as I mentioned yesterday, one thing that's going to happen is you're doing a COVID-19 test on all preoperative patients. It's going to really help them that we've developed this capacity. So when you ask me about that capacity, I think a lot of that will go towards our private providers so they can reopen and people can have those surgeries they've been putting off. Thank you.
All right, thank you, Dr. Williams. Governor Parson?
Yes.
Hello, Governor. So today you were touring Hy-Vee and Orscheln's, and so you've been out in the public, and I guess one of the questions that our readers have you ever been tested for COVID? Have you ever felt the need to be tested?
I have not been tested, never felt a need to it.
Okay.
And just been at work every day since this all took place, and I feel good and I feel healthy, and there's a lot more people out there that probably needed that test more than I did.
Hi, Mr. Governor. State Representative Dean Dorman attached an amendment to House Bill 2010 yesterday affecting county health departments that would county health boards would function in an advisory capacity only to county commissioners. So do you believe that county health officials should only act as advisory to county commissioners to make these health-wide orders?
First of all, I would hope they work together to start off with, but I think the way we've been doing it for years seems to be working pretty good. You know, look, doing legislation sometimes at a time of a crisis is not always the best way to do business. I get everybody wants to respond and wants to do something, but I think sometimes you really got to look and see long-term what is the effect of what we're doing here. You know, right now we've had a system in place for a number of time that's worked just fine. You know, again, we've been into this 60 days, so I think we want to be really careful about how we move forward. Who has the ability to make those decisions? But for the most part, I would hope that county health departments are working with the local counties. They sure should be. I'll just say that. And if I think that was become a real problem, then I think there's ways to address that we may. But right now, again, I'm not for sure what all legislation, what all amendments are out there. I'll answer the question as best I can, but I don't know what that'll be at the end of the day.
Hi, I'm Claire with the Columbia Missourian. If this vaccine does become available by the end of the year, do you have a plan in place to make it affordable or even free for Missourians?
For the vaccine?
Yes.
Oh, I'm not sure where that would be, but I'm sure, you know, the people that would have, I'm sure the insurance would be involved in that, how we would move forward. I think it would be premature for me to try to say it would be free for everybody in the state of Missouri, the vaccine. Again, that's something we'd all have to analyze and see what was the best and how we would do that. You know, first steps first, you know, you got to get it out there, even make it available. So that would be the first goal, I would think, of what Pfizer's doing and what we're doing to make it available, and then we'll figure out how we pay for it from there.
Governor, the health director of the Kansas City Health Department has said that there could be reopening policies by local governments and that they could be retightened by the end of June. What thresholds in the data that the administration is, what thresholds are they considering to reinstitute any restrictions if a spike in infections occur?
Okay, let me go over that again. The hypothetical things that are being asked all the time. I don't know what's going to happen in June. I don't know what's going to happen in the June with COVID-19. So first of all, that's a total speculatory question. Every day I'll go back. We are looking at the data that we have in front of us that we know for sure. We look what we call the models or the dashboards that we have to make the judgments on that. In a way, we're going to watch all of that. We'll watch the hospital, the intake of the hospital, how many ICU beds, how many ventilators, how many people are testing, how many are positive, what the needs are. We'll get all of that information to decide what actions we will take. If Missouri keeps declining, then, you know, we're going to keep trying to look at that through the month of May and then make decisions at the next order. So, you know, I think any of us is trying to speculate into what's going to happen towards the end of June is just strictly speculation. There's no need for me to do that. You know, I think, again, let's take it day at a time. Let's see what happens 2 weeks from now, and then let's see for a month, and then we'll see where we go.
So what you're saying is the number of hospital beds available is going to be a huge indicator as to whether restrictions need to be tightened again?
It would be one of the indicators. Again, there is no one indicator that trips any trigger for everything. It's a multitude of things. Does a lot more people test positive across the state as a whole? Do people test in hot spots where their area? There's a lot of factors in that. So again, I think that's why I caution everybody when we like to use the positive numbers. I use them every day in my briefing, you know, but the reality of it is the number I give today, the 9,341 positive cases, is frankly not even accurate as it is today as I say it. So that number will grow every day, but probably a very small majority of people in that number is positive COVID-19 right now. So again, you got to look at all this information daily. You got to compile all the information to make decisions. So we'll make the decisions as we get through May and the 1st of June comes. We'll be ready to make the next decision on how we move forward. All right, well, thanks everybody for being here today. I appreciate it. I will be back here on Monday, so thank you very much. Thank you.